asking your staff personal questions. Make them know that you care about them on a personal level. They're going to rise to the occasion for you, where if they're just showing up for the paycheck they're getting, they're only going to go to bat for you as hard as that check is going to pay them. So I think when the people feel respected, they feel heard, and they want to support you, it's going to just so much better.
Welcome to this episode of the Leading in Dentistry podcast. I'm Dr. Wes Eggett. After spending the last 20 years in a variety of leadership positions, and as a student of leadership myself, I started Leading in Dentistry to share what I found and to continue learning with you. If anything from this episode stands out, check out the show notes, our online courses, or one-on-one coaching on leadingindentistry.com. Welcome back to another episode of the Leading in Dentistry podcast. I'm Dr. Wes Eggett. For those of you new to the podcast, I'm a practicing associate dentist just outside of Denver, Colorado, and I started Leading in Dentistry to help develop the leadership skills of each team member in the dental office, not just the business owner. And today we have a guest, Tony Schicktanz, who's going to help us out, really understand that leadership aspect of, helping be a member of the team while not actually being the business owner, also known as the educated associate. Tony, go ahead and introduce yourself. Tell us a little bit about...
Thanks for having me on. So I am an associate doc myself. Went to the University of Colorado for dental school, got out of there kind of mid-pandemic time. Anybody that was in school or transitioning out at that time kind of saw the hits our education took due to the limited patients we were able to see. Anyways, was able to get out, graduated on time with most of my class. At that time, my wife had just finished medical residency, so we were going to have to move for her residency. And if anybody knows anything about medical residency, they just tell you where you're going. You don't really get a whole lot of say. So we got matched in Albuquerque, so we moved to Albuquerque. So I had to kind of figure out a job in Albuquerque. No friends, no family members there, didn't know a soul. And so I frankly struggled finding a job. I started really early in my D4 year. I started probably around this time, January or February, digging into Indeed and Glassdoor and all these websites and going on Craigslist. I saw that it wasn't the easiest thing to do in the world. And so I started Googling, hey, how do people find these jobs? And there wasn't a ton of really fruitful information with actionable advice. Hey, go here, do this, no, avoid that. I struggled. My 3 good buddies in dental school, I watched 2 of them go through a similar thing. Now, I ended up finding a great job that I was really lucky and happy with, but then I had other classmates that had an exact opposite experience, and I stayed in good communication with a number of people and just chatting with them and all of us kind of sharing our stories. I realized that I wasn't alone in this vacuum of the associate world, and that many of us kind of get sucked into this thing. It can take you for a ride if you're not kind of anticipating some of the turns. So that's when I decided, kind of 2 years after graduating, I wanted to start putting out info to try and help the next batch of docs coming through, so that hopefully there would be a little bit of info to help them steer that course. Yeah, and I've just been trying to make content along the associate lines to try and help you earn more, negotiate better contracts, avoid the pitfalls that I ran into or I had buddies run into, and just hopefully do better for all of us.
Cool. I have the copy of your book here, How to Land Your Dream Dental Associateship. Great book. There are so many things that I learned here that I know I would have been in a bad situation because I didn't know any of that stuff. And you're saying that some of it you kind of landed into a good job. Do you think you landed more into it by luck, and then you thought, oh, these are all the great things? Like when I married my wife, right? Along the way, I found so many things where it's like, wow, I really lucked out in that regard. Do you think with your associateship it was the same, or do you think you knew what you were getting into when you hit the word go?
I think that's a really good point. I think you kind of nailed it with those things. I think a lot of these bigger decisions in life, and certainly marriage is way bigger than an associateship, but you kind of have those good feelings, and you kind of as an adult start to know your how things feel in your belly when you're making these choices, and you kind of got to use your gut. But I would say there was a few things that I knew that were my strict, I was going to find these. I wanted a private practice. I knew that I was not going to do a big DSO right after school. And not to say, now that I've worked in a DSO, it's not been all bad like I heard coming out of school, but I heard so many horror stories that I just said, you know what, not for Tony. I'm going to avoid this at all costs. So right from the bat, I knocked off all the DSOs. And I really wanted to work for somebody that was a quote unquote super GP. They do implants, they do Invisalign, they do a little of every flavor. Now, they still refer stuff out to OS and refer appropriately, but most things stayed in house with this guy, and I thought that would give me a great chance to learn. And he was actually really willing to mentor me clinically, and that was the other thing I wanted. And that was really probably my number one thing outside of the DSO, is that I wanted the doctor in house that would be willing to actually step into my room and be like, no, no, you got to access the tooth this way to find the canal, or, oh yeah, you don't elevate this tooth that way, you got to put the luxator over here, or whatever. And he did that. I would be getting stuffed by trying to take out number 11, fractured off at the gum line. In dental school, you're terrified to use the handpiece to cut away any bone, and I'm just sitting there digging at this thing, and I'm like, all right, doc, can you come in and help me? Guy comes in, little bit of bone reduction, tooth's out in like 5 minutes, and I'm like, oh my gosh, what a learning experience. So there was those things that I knew I wanted and I got, but no, I got lucky in some ways too. The volume of patients, the amount of new patients I got to see, a lot of the patients were heavily, well, they were all insurance based, and a lot of it was Medicaid or DentaQuest. So a lot of people did the treatment. So I felt like I didn't have to have excellent communication skills, and people did, they signed up for the work. And so I wanted to learn how to be better at drilling, doing teeth, and it gave me those things. Now, there were things that were not good, and there were reasons why I left eventually, but I think those were my things I wanted, and I got those. So in that sense, I was very happy.
Yeah, so talking about the leadership side of things, I feel like this is something where a lot of graduating docs find themselves stuck in the middle of two worlds, right?
Mm-hmm.
Where in the past, and a lot of the stories we hear that get us interested in doing dentistry, not just as, the clinical side, but also what it can offer you in a lifestyle, comes
Mm-hmm.
from people that we've seen in the past that were all practice owners, right?
Mm-hmm.
And
Totally.
and then we get into it, and then the world of dentistry is changing, where we're going to have a lot more people who are in associateships for a very long time.
Yeah.
And so we have this dual role of being the doctor who has a position of authority, but also being an associate who's just a member of the team, who's an employee. And so you're kind of stuck between these two worlds, and it puts us in a weird position. So as you've gone through that and seen yourself develop as an associate dentist, and also have to be a leader of the team in different capacities, what kind of lessons have you learned along the way? What's been your experience with leadership as you've been put into associate roles?
Yeah, I think that's a super awesome question. I feel like this is one that in many ways it's probably personal in how many everyone's going to respond differently.
Mm-hmm.
I've always kind of felt like I'm a situational leader. I don't like to be the one in front of everybody that's always like the full-time leader or something like that, but I've always felt like in moments I've been able to step up and kind of be the leader. And I think the associate role is exactly that. There's definitely times that you're right, the entire staff, my assistant, the hygienist, there's many days I work and I'm the only one there, and I am calling all the shots. And you do have to be being in that full-on leadership kind of owner-like position all day. And then there's times that the owner is there and I'm playing second fiddle. And quite honestly, I've had a couple times where we're like hiring a new office manager and the staff's giving me all these opinions on who they want. And I'm interviewing with the owner, but I really know it's up to him. Like at the end of the day, if I want somebody and he wants somebody else, we're definitely going to go with his choice. And that's totally reasonable. So I think it's been knowing when to step up and trying to be the leader, and when to just say, you know what, this isn't my thing. I'll let him run the circus today. We'll be okay with that. I would say another, like, just again, personal thing for me, I don't take things very personally. So if someone else wants to step up and be the leader, or he says no, or she says, you know what, we're not doing it that way. We're hiring this person. We're using this material. For the most part, I'm cool with just rolling with the punches and just going with that. So I'd say it can be a weird position. I feel like the weirder position, and fortunately I haven't had much of this, is when you have other staff members kind of knocking you down your rungs. And like I said, I haven't really had to deal with that on a personal basis a whole lot, but I've talked to a lot of people that they're feeling disrespected by their assistant, or their hygienist is telling them they diagnosed the wrong thing and they're feeling belittled. And just trying to figure out, like, do I stand up and say, I'm the doctor, this is my thing? And that doesn't really seem that right to me. It can be a weird spot to be the associate where you're not stroking the checks to everybody, so they're not going to listen to you on everything.
So that's super interesting, because I haven't experienced that myself, and so it hasn't been something that I've really thought much about. From the first thing you said, you were talking about lessons learned, or the things that have been beneficial for you. It sounds like it's a combination of flexibility and capability is what I'm kind of getting from what you're saying. So you have to have the capacity to step up when needed. You have to be, you're not the person who's going to be put in charge of everything all the time, but when you're asked to, having the ability to step up and do that. I think that also makes you very valuable to the practice as an associate. The owner knows they can rely on you, but then also being flexible when things are not necessarily going the way that you would have called it, being able to roll with the punches, like you said. But then also the second part, that's the thing, I've never even thought about that before, having that experience of being belittled by the staff because they don't see you as the owner. They think that they can get away with things with you that they wouldn't be able to get away with the owner.
Totally.
And have you heard, so you that's something you've come across, not necessarily through your own experience, but through talking with other people, I assume.
Big time.
Has that been something that's pretty common that you hear about, or is it just, one-off here and there that you've heard of?
So I would say, really good question, way to phrase that. But hard to say. I would say, in a sense, it, like a lot of things in the world, you hear more about the negative, and the negative things tend to like stick in your brain a little bit more. It does seem like over the last 2 or 3 years, I've heard a lot of different people either DM me that, just talking with previous classmates. You know, my wife being a physician, she's a petite woman, and I know in the hospital, a lot of times she gets called nurse and stuff along those lines. Just people automatically think she's a nurse, and she's not. And she's even told people and been told again she's a nurse. And so a lot of times I don't think it's like directly intentional, and not that intentions always matter, but yeah, I've seen it more. It seems like younger docs, they look younger physically. I always tell people I've worn a beard since I graduated because I've always worked with people at least 10 years older than me. And I don't want to seem like I'm a baby. So luckily, I can grow a beard and it works out for me. But a lot of people don't have that. Or for females, maybe you obviously don't have a beard, so you're stuck. And they do. I've heard these stories where this assistant's worked for the owner doc for 10 years, and the owner always did it one way, and it always worked great. And now you're coming in and you're wanting to do something a little different. And the assistant's like, no, you're going to do it this way. No, you're doing it this way. No, you're going to do it this way. And you're like, no, we're not. This is, again, my treatment. And like, how do you cross that line? Do you step up? No, I'm the doctor in this room. I'm the one doing the surgery. This is the way we're doing it. I've had people that they tried to go to the owner, and that doesn't ever seem to work. They kind of end up backing up their assistant, and it just puts people in these weird spots where, frankly, they always end up leaving at some point, whether they last another month, 6 months, or a year, play out their contract. Every one of those folks, it seems like they end up just parting ways eventually, not getting the respect they felt they needed. I don't know. It'd be a really hard spot to be in. In many ways, I'm fortunate I haven't had to deal with it. In some ways, I wish I would have had to deal with it, so I would have a better answer on what I did. Yeah, I have heard a decent amount of people bring up that they just felt belittled or not respected by somebody in the office, and it was rarely the owner. It was almost always a staff member putting them down.
That's super interesting. I'll have to think more about that and get some more stories. If anybody out there listening has had experiences with this, please reach out.
Yeah.
The beard thing's hilarious because I 100% agree with that. I look very young, and I had been in the Army, and so I wanted to grow a beard for the first couple months, not even for the age thing.
Yeah.
And so when I had it for a couple months and I was getting tired of it, I shaved it. And the first day I got asked 3 times how long I've been doing this. And so I said, like, because honestly, it affects case acceptance. Like, I had to have it. It
does. 100%.
And so I've had it ever since then. I had it ever since, and then I got my hair cut a little bit shorter, and then I got those questions again. So now it's growing back out. So,
it's very funny how these little things that you're like, man, I can't believe this factors in. But yeah, the question, how old are you? How long have you been a doc? But I've been at this office for 2 years. You've seen me before.
I know. I always respond when they're like, how long have you been doing this? And I just say, I just looked it up on YouTube, but I think we're going to figure it out together.
Yeah. Came in with some humor. I agree. That's a fantastic way to just, everyone chuckles at that. Yeah.
This
is my first surgery.
Exactly. But the thing about the assistants is super interesting because on the one hand, the whole purpose of leading in dentistry is to help develop the leadership skills of every team member in the dental office. Including the assistants. And a lot of times the way that I describe the role of the assistant to my assistants when I'm trying to help train them to be better leaders in the office is that they are the conductor and I am the musician, right? So like I can play the instrument. I want you to tell me where to go and who's set up where and where to anesthetize and where to bounce to next.
Great.
I don't want to have the mental, I don't want to put that mental strain on me. I just want to show up and do it. I like to golf. I want you to caddy for me. So on the one hand, I like assistants that can have those skills and help direct their doctors, especially younger doctors. But on the other hand, it has to be a relationship. Like I don't think leadership is necessarily a leader-follower approach.
Uh-huh.
Um, I think a closer example is, or a closer explanation is more of like a leader and a team member where they're
Yep.
working together. But really, if you
Totally.
just look at it as like team and team, and we just have a leadership relationship where
Yep.
sometimes I'm leading the conversation. It's like a dance, you know. Sometimes I'm leading, sometimes you're leading. We're kind of sharing that load,
Yep.
and depending on what the purpose is in that moment. And so I think developing a relationship, if I were to talk to anybody out there who's going through this with an associate dentist and a hygienist or an assistant that are trying to navigate that dance, uh, I would say start with the relationship. Don't start with
Uh-huh.
the authority. There's this book that I
Yep.
talk about all the time, which is How to Lead When You're Not in Charge by Clay Scroggins.
Uh-huh.
And he talks about leading by authority, which is like I'm
Uh-huh.
the doctor, or leading by influence, which
Uh-huh.
is being able to have that relationship where you know where to give and take because that's
Yep.
what your trust is built on. So there's a ton there to unpack, but what do you think about that?
So this is like a main reason why I wanted to get on your podcast. I very strongly agree with that message. I kind of brought up the situational leader before, and I totally agree about the concert with you and the assistant and stuff. I think that for me, once we've established the diagnosis and all that good stuff, I agree. I want them putting patients in rooms, telling me where to go. Hey, we're in here, DO number 3, over here, you're doing crown prep number 14. Yeah, I don't want to make those small second to second decisions about where I need to be and what's next and what patient's frustrated about waiting, and just get me where I need to be and let's do it.
Mhm.
100%. I think that's awesome. That's an excellent way that assistants can step up. And I also agree. I was medical assistant for a couple of years before I went to dental school. There was many times that it felt like I was calling the shots for our cardiologist, telling him where to go. And no, this person needs this scan. You already did that one, or whatever. And he didn't take that as offense. He didn't. And same thing. Just the other day, my assistant comes in and we're about to do a root canal on a couple lower anteriors, and she's like, what do you think about just pulling those and doing a bridge for him today? And I was like, I kind of talked to him about that. I don't know. And then the patient comes in and he's like, you know what? I want to do that bridge thing. And I was like, oh my gosh, I just had talked about this morning with my assistant and why she thought we should have done this anyways. And I just like go up to her and like high five. I'm like, yeah, he wanted to do the bridge. And so I think having that level where people can step up and tell you, also, I think it's more in the past, but like the doctor's the top and they know everything and you don't question the doctor and you don't say anything to the doctor. I think that's just a recipe for disaster. If I was about to do something wrong, I would hope that my assistant would quietly let me know, like, oh yeah, that crown's on number 5, not number 4. Or just little things that you
Mhm.
can step up and really save the day for you because they felt like they could step in. Where if they feel like you're just going to belittle them. And so I think teamwork makes the dream work, having that team and knowing when different people can step up and be the leader. And then people also do a much better job when they feel like it's their thing. And I know you've hit on this a bunch of times on various episodes, but yeah, I think when people feel like, yeah, I'm the assistant, but I'm kind of making the schedule and I'm telling them where to go and I'm helping do these temporaries and all of these things, that feels rewarding. And it's a position they can grow more in. Where, yeah, I completely agree. Having worked at the bottom and now quote unquote at the top, I think having those various spots is critical.
Just a quick interruption here. If you are looking to take your leadership skills to the next level, the next round of the 90-day leadership development program kicks off on April 7th, 2025. This is a guided program that I designed for dentists, office managers, and team members who want to create trust, set clear expectations, hold their teams accountable, and lead with consistency and heart. The course has on-demand training, self-assessments, bi-weekly coaching calls, and direct leadership troubleshooting, and you'll get everything you need in order to elevate your leadership. Spots are truly limited. I can only do this for a couple of people at a time, so head to leadingindentistry.com/courses to sign up. While you're there, check out the Team Lead Crash Course and the course on leadership for associate dentists as well. I think the big takeaway from that is really knowing that the assistant has a strong role to play, and as the doctor, whether or not we're the owner or we're the associate, like helping them feel that buy-in, that they're growing and
Mm-hmm.
they have some sort of ownership over their position, but also like ownership over their day helps
Yep.
mitigate burnout too, right? Because
Totally.
you just feel like if you are just going and playing by someone else's rules all the time and you have no say in your destiny, so to speak, you just
Yeah,
feel like
you're
a
out.
ragdoll. And yeah, that's where
Yeah.
I was going with it was the idea of you eventually people will leave those positions, right? They'll know
Mm-hmm.
that that's not a long-term good fit for them. And that's
Yep.
not to say that it's not a good fit for somebody else, but you know what your limits are and what your boundaries are and what you're okay with. And I think if you're trying to have that leadership relationship, it all comes back to trust.
Mm-hmm.
In leading in dentistry, we talk about the teach leadership model all the time, built on trust, setting expectations, accountability, doing things consistently and doing them with heart. And I feel like if you
Mm-hmm.
start with that trusting relationship between the doctor and the assistant, can become very mutually beneficial, very supportive.
Completely
Everyone
agree.
feels like they're just in the flow. So,
No, and I think the previous book you brought up about how like the authoritative approach versus
Mhm.
influential approach, totally agree. I think when you have an army of people that love you and they just know like he does the right thing. He's always doing right by the patients. He does right by the staff. He's nice to me. I make like lots of videos about asking your staff personal questions. Don't just,
Huge.
hey, how's your day? If you know your staff member's going through car problems, then maybe every couple of days check in on how that's going. Make them know that you care about them on a personal level. They're gonna rise to the occasion for you. Where if they're just showing up for the 18.25 an hour or whatever paycheck they're getting, they're only gonna go to bat for you as hard as that check is gonna pay them. So I think
Mhm.
when the people feel respected, they feel heard, and they want to support you, it's gonna just so much better.
Yeah, and you brought up earlier about how the assistant can help get you out of sticky situations too. And I remember when I
Totally.
was in the army, I you always are the dentist, but then you also have what's called an additional duty. It's something else that you do on top of being the doctor. And so one
Okay.
of my additional duties was to be the patient safety officer. And so it was all
Mm.
about helping patient safety. I went to patient safety trainings. We talked all about that dynamic between, you know, how you talked about the old school doctors in charge, don't question the doctor, that kind of thing, and how that
Yep.
can lead to so many patient safety incidents. And
Totally
the
agree.
big thing that I like to also tell assistants, not just like the relationship with the doctor, I like that analogy of the musician and the conductor, the golfer and the caddy, but also
Hmm.
with the patient, I think that the assistant's main role is to be the patient experience expert. Like your whole thing is you're the concierge. You pick them up from the waiting room, you bring them back, you help them feel the flow of everything. Sometime the
Hmm.
doctor is going to walk in and do their thing, deglove, get out of there,
Yep.
and helping them feel like that's not choppy, right, is huge. But then also being able to save that patient from some sort of patient safety incident where if you see something going wrong, being able to speak up. But all of that plays into that assistant feeling like they are empowered, like they
Yep.
can be the tour guide of the practice and the tour guide of the patient experience for that day, including looking out for them. Like
Hmm.
when I first started at this practice in the army, man, we put in the dry shield or the isolite and we just went to town. And in the private practice I'm working at, they're very big on, you know, giving patients an opportunity to take a break and swallow. And so when I first started,
Hmm.
I didn't have the dry shield and I'd just start going to town and I'd be, you know, they'd be open for 10 minutes. And then the assistant would, okay, slow down, give them a chance to
You need a
swallow. And
breather.
I'm like, okay,
Yeah.
exactly. And so that was huge
Yeah.
for me because, you know, just because, I wasn't new to dentistry, but I was new to this style of practice
Different
and
style. Yep.
what's the culture of this practice and what kind of experience do we give the patient and the assistant can take care of all
Hear
that.
that? And you didn't take it personally. You
Mm-hmm.
said, okay, this is what everyone's accustomed to. If I'm gonna do more and better dentistry here that way, then by all means, please tell me these things. So yeah, I think you said that was really a beautiful way to think about it. I'm gonna start using that when I talk with my assistants. You're not the just assistant. You really are. You're the patient experience supervisor, and
Uh-huh.
they really are. I mean, from the
Absolutely.
front to back, they're with them the whole time, uh, and during what can be a stressful, painful, horrible experience for a lot of folks. So yeah, I really like that, and I appreciate you sharing a personal story too.
Yeah, of course. Before we wrap up, because I want to, we're getting towards the end of the time here. I want to
Hmm.
ask more about your personal development as a leader, as you've gone through and been an associate, and a lot of the stuff that you've put out, at least, has been more about, the I don't want to say the business side of being an associate, but it's about
Hmm.
understanding how to set yourself up for a good career, and all that plays
Hmm.
into like the non-clinical things that we don't often talk about. But for you developing as a leader, what type of research do you do? What type of resources do you subscribe to? Is there anything that has been beneficial, recommendations, books, tips, quotes, things that really stand out for you that help educate your leadership philosophy?
Yeah, I think good question again. Uh, Quick and dirty on my career, I'm pretty type A like most of us, and I alluded to it at the beginning. When I first got out of school, I wanted a position to learn clinical dentistry. I didn't really want to have to call the shots at all in the practice. And the guy I signed on with, that's how it was. I mean, he called all the shots in the practice, and that's what I wanted. I didn't want to think about collections. I didn't want to think about anything, what insurance we were going to take. I wanted to come in, learn dentistry, become quicker at dentistry, become better at dentistry, and learn new skills. Did that for 2 years, was ready to move on. Second associateship, I sought out somebody that was going to teach me more about the business. Um, it was a male and female doc. They were less willing to teach me clinical stuff, but man, they pulled me into all the meetings and meetings with lawyers, meetings with accountants, meeting with everybody, and I'd get to hear the good, the bad, and the ugly, what needed to be changed, what was fantastic. And it was a pretty darn successful practice. So it was good to see the nitty gritties on how to do that. Third associateship in a DSO. Um, it's a DSO in the sense that it's owned by a DSO, but it's very hands off. They don't really ever come. We do pretty much everything on our own, and I'm virtually kind of the owner most days. I call all the shots. I pick all the supplies that we want. I pick the insurance plans that we'll take. So just over time, trying to funnel my way into kind of more of that, I guess, back to front leadership. Uh, and then I'm a lot like you. I love a lot of books. Honestly, I'm blanking on any names off the top of my head. I've got like my bookshelf over here with all the books that I've read over the last couple of years. But I listened to a podcast of yours. I'm not sure. Maybe it was a couple of weeks ago. But he talked about learning and leading by example, or you have to kind of learn by doing it, I guess.
Mhm.
And so I'm a firm believer in that. You got to try the things. I heard a quote the other day that if it was all about education, we'd all be millionaires and have six pack abs. We all know how to be skinny and ripped and make money, but uh, the world's not
Yep.
filled with people with six packs, and we're not all millionaires. So clearly, information's not always the issue. It's getting out there and doing it. So um, that's what I think, and that's what I've tried to do. Is as I've been less worried about drilling teeth, I've wanted to learn more about leadership, and so for me, it's worked good in that I eventually I wanted to get into practice ownership, and I think like I'm pretty much ready to cross that bridge here in the next short period of time. So I apologize that I can't think of any books off the top of my head or things that I've used, but books for sure have been the backbone of my all my learning outside of dental school.
Sure. I think that that's totally fine. I think that hitting on the importance of the experience is key because I feel like a lot of times leaders will learn a lot of things in theory, but they've never
Hmm.
done the things themselves. And being able to
Yeah,
have had those experiences where you learn by doing, learn by failing, and having
totally.
that is huge. Like I feel, when I started leading in dentistry, I didn't start it specifically for business owners because I'm not one. That would be disingenuous
Hmm.
of me to give advice to folks in that position when I haven't done that. But that doesn't
Yeah,
mean that as an associate, I haven't had leadership experiences. I've had them outside of
totally agree.
dentistry. And in the Army, I was in charge of
Hmm.
two clinics for a couple of years. And then I was in charge of a much bigger clinic for another 2 years after that. And I was in charge of pretty much everything there.
Hmm.
And it in the Army specifically put me in a weird spot where uh just like an associate, I'm not the head honcho. That there's a very big chain of command there, but I also was
Mhm.
calling the shots around what was happening in my sphere. And
Your
so,
framework, yeah.
exactly. And so just like
Yep.
learning by those experiences of doing it, trying it, putting yourself out there, being willing. So you talked earlier about being coachable, about being flexible, but also
Mhm.
about being capable. And I also feel like being willing to be wrong and willing to mess up and trying things out. And that comes from a place of humility and coachability again, but not being so stuck on, that old relationship of doctor and everybody else. If you have that mentality yourself,
Never gonna
you're
grow.
never gonna try anything because
Yeah,
you're gonna feel like like you can't mess up and you're in this like perfectionist mindset, and it's just it's gonna be defeating towards what you're really trying to accomplish, which is developing yourself, developing other people, that kind of thing.
totally. If you can find me a dentist that's practiced clinical dentistry and can't relate to that sentiment, I'd love to meet him or her. I think all of dental is you got to try and fail, and we're hard on ourselves. We're always saying fail. Well, maybe the filling you did wasn't perfect right after dental school, and is it as good as your 10,000th? Well, I'd sure hope not. But yeah, always growing, seeking advancement. Um, you got to try to learn, and then I think knowing appropriate spots to back off, or having that coach that can step in and I wouldn't have said it that way. Maybe try this next time. Um, so yeah, I think that was awesome.
Cool. Well, is there any last bits of advice or anything that you would say to any of the associate dentists out there or the assistants, people that just want to level up, take things to the next level? What would be your last parting advice?
I would say maybe not directly along those lines, but one thing I always try and tell associates is we've talked a lot about meshing into the practice and kind of things along those lines. But I think at the end of the day, knowing who you are and being the best you, um, if you're a funny person that likes to make jokes, you can't be dead serious all day with the patients. You're going to have to be who you are. And I think being who you are is going to, one, make you more comfortable in your job, but two, actually attract the types of people that you'll work better with, the types of patients that you'll work better with, and then again, you'll be happier. So I think that was something that I kind of struggled with right after school. I tried to fit the mold of the practice, and that's important. You can't be the square peg in the round hole, but maybe you bring a little bit of you and show who you are, and you're awesome. You made it through dental school. You got into dental school. So, or you're an assistant, you're breaking into the dental world. You might spend the next 40 years in dental, and you might climb all the way to being an office manager at a big DSO making buku bucks. So, today's not the top of the mountain. Keep climbing, stay positive.
It's awesome. Well, last thing here, where can people find you and reach out for more resources? How can people get in touch with what you're doing?
Yeah, awesome. So I've got social media. I've got Facebook, Instagram, um, Threads, although I don't do much on Threads, and then a website. So my social media account is The Educated Associate, and then my website is theeducatedassociate.com. You brought up the book earlier. It's for sale on Amazon. I also did an audio version. I know how we're all wicked busy dentists, and throwing it on in the car might be your best bet. So it's up on Audible, Spotify, Apple Books, a million other websites online. So if you're a listener to books, you'll probably be able to find it. It's called How to Land Your Dream Dental Associateship. And then again, all that stuff's on my website and my social media account. So appreciate you shouting me out there, though, Doc.
Of course, of course. Well, once again, thank you, Dr. Tony Schicktanz.
Yeah,
You have yourself a great day, and I encourage everyone to grab a copy of the book. It was a great read and super helpful for anybody in that situation. But you have yourself a great day, and we're gonna have you on
and the
again
same, Dr.
sometime.
Eggett.
I want to hear the story
I'd
of your
love to get
growth and
back
where
on.
things take you next.
Yeah, this was awesome. Thanks again for your time, Dr. Eggett. This is an awesome thing you're doing, and I'd love to get back on. So anytime.
Awesome, thanks, man.
And that's it for this episode of the Leading in Dentistry podcast. If you learned something today, please leave a 5-star review and share the episode with a friend. If you're ready to take the next step for yourself or provide leadership training for a team member, visit leadingindentistry.com to check out our online courses and one-on-one coaching.